Let's restate some of the syndromes that may be present in a family. And I want to ask you both here what you mostly see in your practice, because a lot of these are specific. Some of them we've talked about, others we have not. Doctor, let me ask you first of all, out of these hereditary indicators here, which one do you see more often than the others? Is there one that really sticks out to you?
It would be maybe close relative with some kind of cancer. In many cases, the patient are diagnosed with cancer, and then they are referred by the patient. We gather the information. When the patient is referred, usually the doctor already know that there is a strong family history of cancer. And also we see early ages of diagnosis, and that is usually when the patient is younger than 45 years old.
Jessica, would you concur, and is there anything else that stands out to you in this list?
Certainly, I agree with Dr. Martir. We see a lot of those criteria in our practice. We also see people who have developed multiple types of cancers, different types of cancers throughout their lifetimes, and that's definitely an indication for genetic counseling and potentially testing.
Doctor, you mentioned insurance a couple of minutes ago. This has got to be very expensive. So does insurance cover something like this?
If the patient meet the guidelines, the National Comprehensive Cancer Network guidelines, is usually covered by insurance. The test used to be very expensive, especially when there was a patent for 2 genes, and this is back in, for many years there was a patent, and genetic testing was about $4,000 for 2 genes. In 2013, the Supreme Court ruled that you cannot patent something that happened in nature, and the same day, genetic testing went from $4,000 to $2,200 for the 2 genes, and that opened the door for genetic cancer panels. And now the test, if the patient have to pay out of pocket, is very affordable, and with payment plan, given the competition between labs, and we're talking about, in some cases, less than $400.